action.
Hi, how are you doing today? My name is Brittany. I'm going to be your student nurse. Can I please see your ID band really quick? And can you verify your name and date of birth for me? And then any allergies you have? Latex. So we're going to make sure that we're not using any latex in anything so that we don't give you an allergic reaction. Today we do have an order for a catheterization, which is a Foley. So it's just going to basically help you to go to the bathroom. It's also going to help relieve that pain that you're feeling from urinating with your UTI. Is that something you're okay with? Okay, we're going to start that. Normally I would raise the bed up, but this bed does not work. So I'm going to put this up here so that I can see the area, okay? And I'm going to have you bend your legs. Thank you. Awesome. So the first thing I would do would be perineal care. I would lay down a little chuck right here and I would make sure to put on gloves. I would clean first the outside labia, throw it away. We clean this side of the labia, throw it away. Get another one, go straight down the middle, throw it away, and then pat the whole area dry with a dry wipe. So now we're going to start the catheterization. Let me just place this down. Okay. Next thing we're going to do is grab the sterile field, keeping the 1-inch border, and then locate the shiny side, which we're then going to put down, making sure that our sterile gloves are not touching anything. Awesome, that's placed down.
It's not actually wet.
No. And then we're going to take this, place it right there. We normally would have lube, but we cannot use the lube that's provided on our mannequin, so we have already placed some lube on the tray right here. We're then going to take our catheter over here, and then we're going to take this plastic off, making sure that while we're taking it off, the tip is not touching anything and not becoming dirty. So then we're going to bring it over here, dip it in the lube, and then place it down. Next we're going to take the Q-tips and we're going to do some more care. We're going to take it out, do the outer labia, throw it away. Another one, the other outer labia. And then down the middle and throw it away, throwing the whole package away. The next thing you're going to do, you're going to insert the catheter. So we're going to grab the 2 labia and we're going to spread them. And the next thing, we're going to grab the catheter, making sure that the urethra is open. We're going in. Oh my gosh. And we're going to continue to go until we start to see urine fill up the clear tubing at the end, but since that is not going to happen with our mannequin, we just go until we feel some resistance. Okay, I'm starting to feel that resistance, so I'm going to stop. I'm going to then hold over here so that it doesn't slip out. I'm going to grab my normal saline, take off the cap, and then I'm going to insert. This is a 5 milliliter balloon, so we're only going to inject it with the 5 milliliters. There's 9 in here, so we're going to go to 4. And while we're here, I'm going to twist off. Place it down. So at this point, we're going to then pull a little bit on the tube to find where the resistance is. I mean, it's placed in the catheter. And then there's normally a little sticky thing right here where this will snap onto so that it doesn't fall off. Then we are going to take the bag. We're going to then bring it over. It's a little twisted. Okay. And then we're not going to hang this on the bed rail. We're going to hang it on the actual bed frame. So I'm gonna come down, actually hang it. And while we're here, we're going to get a urine sample right away so that we can get the fresh urine. So uncap. This comes out. We're going to fill. And then once we do that, we're going to bring it this way. Cap the urine tightly, and then put this back in. After we do that, we would put the patient's name, the date, the room number, the time, and also our initials on it. And then as well, while we do that, we're going to put this in a zip or in a bag so that we can send it off. And also on the catheter bag, we're going to write our name and initials, what time it was done, what time the catheter was done, and everything else. So that's it for putting it in. Now let's go over taking it out very quickly. So normally we would just come in with the syringe, and then we would grab this. You're going to insert it, and once we insert it, the pressure is going to drain the balloon. So. And then while we're there, we're going to pull a little bit more to make sure everything's out, because you don't want to pull a inflated balloon out of the urethra. It's going to hurt. So we're just going to pull out, and boom, we're out. And then you would throw this right away. So, thank you.
Okay, S-bar, take 397.
My name is Brittany. I'm the student nurse today for Meredith Fitzpatrick. She's in room 228. She did come in with a urinary tract infection. So she does have an allergy to latex, and she's on 2 different medications. The first one is normal saline. She's being given 100 milliliters per hour, and it's a continuous IV infusion. She's also being given Rocephin, 1 gram IV piggyback every 12 hours, and that's an antibiotic for her UTI. So for her general assessment, we did come in and we checked her perineal area to see if there was any skin breakdown or abrasions that would concern us. Then there was not. So we continued with perineal care, and then we gave her the urinary catheterization so that she could go to the bathroom with a little more ease. After that, we did get a urine sample right away to make sure that the urine was fresh, and then we would send it off to urinalysis. So for the recommendations, we still do recommend that she has perineal care and catheter care every 8 hours or when needed. Also that she continues to take her medications to make sure that that bacterial infection does clear up. And lastly, that her urine collection bag should be emptied when it's half full. And that's it.
Okay. Hi, Ms. Fitzpatrick. It's me, Jacob. I'm going to be your nurse today. I'm going to give you your meds, but first let me just make sure I'm the right person. Just make sure. Can you please tell me your name and your date of birth? Okay. Do you have any allergies I'd like to know of?
Latex.
Latex? Oh, okay. So we'll make sure we avoid using that. Okay. So the two drugs that we're going to be giving you is normal saline and Rocephin. Okay. Rocephin, that's going to be your antibiotics, and that's might make you nauseous or a little dizzy as a side effect. And then we have normal saline, which is gonna basically work to hydrate you and work alongside your Rocephin. And saline, you might actually have a metallic taste in your mouth. Okay. So I'm just gonna turn these, get my meds according to MAR. So I got my Rocephin. It's upside down, but it's I'm basically checking the dice, so I'm checking if it's the right drug according to here. That's good. It's intact, it's clear, and it's not expired. I'm going to do the same thing here with the normal saline. Checking if it's the right drug. It is the right drug, and I'm also checking if it's intact. If it's clear, it's also not expired. So I have these right here. So I'm going to work first with the normal saline. Let me just put that their keys. Okay. So here is primer one. So I'm gonna spike it. So I'm gonna spike it. This is not connected to her yet. By the way, it's all locked right now. So I'm just gonna let this. I'm gonna prime it. So first I'll make sure it's water's coming out. Okay. So that it did spike correctly. Now I'm just gonna make sure line's open and prime it. So get all the air out of there, you know? So this is working correctly. Should this lock, I think this one right. No, that's not locked. Okay. So yeah, now it's open. You can see here, and I'm locking it up.
But you can't even see the strip.
Again, this is so far away. So now that I've got that, I can now hook it up to the layers pump. So I'm gonna open it right here. I'll get it turned on. It's in there. There. Isn't in. It's locked right now. Okay. It's okay. I'm checking channel select. Going for basic infusion. And then we'll check the mod, make sure we did this right. So this is normal saline. So this is gonna be 1,000 or 100 milliliters an hour via continuous infusion. So we're given 100 milliliters an hour, and then for our lime to be infused, this is at 1,000 milliliters, so a liter. So I'll put that to 1,000 here. Okay, and then when I'm connecting this up to our IV, I make sure I wipe it, and then I connect it up, and now that's in there. So then I start, and now this should be good. It's unlocked. Let me fix that really quick. Okay, now this should be going. I'll check here to make sure it's dripping. So there we go. It's dripping now. So that's good. Now I can set up the piggy back. So again, when I would check, I would dice it, and I would make sure right drug. It's those also, and I also see if it's intact, it's clear, and it's all not expired. So once I have that, I can get ready to spike it. So I spike it.
You gotta wait because it's getting through a long line, and I need to see this. And then you close your valves. Start your secondary.
What I'm gonna have to do before I set it up though is back prime it. So I'm gonna wipe this part, clean it, and then I connect it here. So now this should be able to back prime it as soon as I unlock this.
If I see you messing up, I'll stop you. Okay?
There we go. It's back priming. I'm getting all the extra air bubbles out of there so it doesn't go in our patient. And now that's going halfway up. I can hook this up right here, and then I'm gonna want to lower this, but I'm first gonna set up my rate in addition to that. So that, and now I'm gonna just go channel select, make sure my rate's good. Secondary rate, according to the mod, I want 1 gram IV, and this is 1 gram per 50 milliliters, so I want 50 milliliters an hour.
That's okay. It just took me a long time.
And then volume, this is looks like 50 milliliters total, so I'm gonna remove that. I don't have to cut it early because this is gonna take over as soon as it is because it's at. So that's good. I'm gonna make sure this is all working well. Is it stripping? Yep, it is. Yep. Okay. So that's good at that rate. I would check this Patrick for any infiltration, such as cooling. I also assess if there's any retraction. And it should all be good now.
No, I'm kind of like, okay.
Do me wrong, but do me right. Tell me lies, but hold me tight. And save your goodbyes for the morning light. But don't let me be